And then
So before I enter the patient's room, I'm going to check the chart, ensure there's no contraindications, which I'm not seeing. So I'm going to knock on the door, pull the curtain for privacy. Hi, my name is Lauren. I'm going to be a student nurse today. How are you doing? Good, good. Alright, can I just see your wristband? Can you verify your name and date of birth? Good.
It's Amy Gervin, 12197.
color is normal.
So what we're going to do today is I'm just going to be performing a head-to-toe assessment. Is that okay?
Yes.
Alright, perfect. So we're just going to start out with some vitals.
Okay.
Here's a
Great,
little
and just
cold,
look
but
for
that's
me.
okay. Very good. I'm have you pull your socks off so I can have a look at your feet.
Alright, the temperature is 98.5.
No pitting edema. Color is good.
And I'm just going to take your pulse next.
Capillary refill on the toes is 2. Very good. Alright, that concludes our health assessment. Are there any other things that I can do for you today?
That's it.
Alright, thank you for your time. And here's the call bell, and your bed is up or down. The bed rails are up, and I will return. Thank you.
Thank you.
This is like
20 minutes long.
oh no. Did I miss anything?
I think you got into that. Except for level of consciousness. Did you do that in the
Nope. I bet I can add that in there.
Yeah,
Let's do that.
like edit. I would edit it in. You sounded good. Both of y'all did.
Did I sound good? We need to see if I missed anything. I'm just going to add the level of consciousness real quick and figure out how to put them together. Okay. Can I do that really quick? Can I just assess your level of consciousness?
Alright, so your pulse was 80 and your respirations were 18. Okay. So next I'm just going to do your blood pressure. Did you have a preference for your blood pressure?
Oh, no, it doesn't matter.
I
thought you were forgetting the femoral fold.
I did. Oh. I'm going to record it in the ad. Did I did say 3, 4, and 6, right? Did I say cream of 2? Did I look at your optical fundus? Let's see. That was in the
I don't think that you did.
Wait, I need to delete this. Oh no.
Okay, so it is 120 over 78. And at this point, I've already taken the height of weight. So just stick your finger in there.
When she said
Alrighty, so the oxygen is 96%. So that concludes the vital. Alrighty, so next what we're going to be doing is I'm just going to be assessing the level of consciousness. Alright, so the patient is awake, alert, and oriented times 3. And then I'm going to test the grips. Just grab your fingers. Perfect. Push against my hands. And pull. Right, and push against my hands. Good. Alright. Okay, so I'm next going to begin testing the cranial nerves. I'm going to test it with a piece of gum. So I'm going to test the olfactory nerve by having the patient smell the gum. So just close your eyes for me. Tell me what it smells like.
It smells like mints.
Good. And next I'm going to have the patient read the small print, and this will be testing the optic nerve.
Extra.
Good. And then for the oculomotor, trochlear, and abducens, I will have the patient follow the 6 positions of gaze later. Alright, and for now, the trigeminal nerve, I'm just going to have you simulate chewing and swallow. And so when the patient swallows, that is testing the glossopharyngeal. Okay, and for testing the facial nerve, I'm just going to have the patient smile. Good. Okay, so the auditory nerve will be tested later when the patient, or when I perform the whisper test on the patient.
I didn't do the whisper test.
The vagus nerve will be tested when the patient says ah, and the hypoglossal nerve will be tested when the patient moves her tongue from side to side. And now I'm just going to be testing the spinal nerve, so just shrug your shoulders. And that concludes the cranial nerves. So I'm now just going to begin the assessment.
I missed the whisper test. Could I add it on there? Okay.
So I'm going to begin assessing the head. I'm just looking for symmetry, and now I'm going to inspect the head. So I'm inspecting for any lumps, bumps, bruises, or lesions, and I'm looking for lice as well, which I'm not seeing any of. Alright, so next I'm going to be looking at the eyes. I'm looking at the sclera, and the sclera is clear.
I'll just add those two things.
And pull down. And the conjunctiva is nice and pink. And the eyes were symmetrical as well. And now I'm just going to look at the pupil size. So they're about a 4 right now. And next I'm going to begin testing Perla. Okay. And then pupils went down to about a 3. Alright, so now I'm just going to have you follow my finger, okay?
I didn't say nystagmus either. And nystagmus is this.
And now I'll be looking at the optic fundus.
Okay.
Do you go to the eye doctor? Mm-hmm. And do you wear glasses or contacts? Mm-hmm. And I also did not notice any lid lag, ptosis, or nystagmus. So now we're going to begin on the ears. I'm looking for symmetry, and they look symmetrical. And now I'm going to palpate the ears. Let me know if you have any pain. Okay. No lumps or bumps or
Thanks for being my patient. Yeah, I didn't do the whisper test, and I didn't do the
And now I'm just going to be visualizing the tympanic membrane. So it's gray in that ear.
Do you think they would care if I made one
And gray in your
out of
pelvis.
it at the end? I'm gonna do it.
And next I'm just going to be performing a hearing test. So just cover the ears.
I haven't done these couple of
Football.
tests, so
Good.
I just wanna make sure you complete your assessment. I'm just gonna ask again.
Baseball.
Good.
You know what I mean?
What?
Just do something.
Okay, so next we're going to begin the assessment for the nose. And I'm looking at the nose. It is symmetrical. I'm not seeing any deviation of the nostrils or anything like that. No lesions, bumps, or bruising. Alright, so I'm going to use for one nostril instead.
I
And
did.
cover the other one.
Okay.
So I'm just going to go over it.
I'm
I'm not seeing any swelling or anything like that. No drainage. Do you have any problems with congestion? Good. Alright, so next I'm going to palpate your sinuses. Let me know if you have any pain. Okay. So I'm palpating the frontal sinus, the ethmoid, and the maxillary sinuses. And I did not notice any swelling. So next we're going to move on to the mouth. I'm looking at the lips. They look nice and pink, and I'm not seeing any cracks or lesions. Can I just have you open up for me? Alright, and say ah, and move your tongue from side to side. Good. And the mucous membranes are nice and pink and moisture. Do you brush your teeth? And you go to the dentist? Yes. So now I'm going to begin assessing the neck. I'm assessing for any lumps or bumps as well.
Yeah. I'm not doing next time, so I don't forget.
So now I'm going to palpate the glands. So I'm palpating the preauricular, the postauricular, the occipital, I'm palpating the tonsillar, submandibular, and submental, and then supraclavicular, and axillary. And I did not feel any swelling. Did you have anything with that? Okay. So now I'm going to assess the thyroid gland. Okay. And I cannot feel it swell for me. Good. So now I will begin assessing the skin. I'm looking for any edema, any swelling, any bumps, bruises, lesions. And I'm going to assess for temperature, which is nice and warm.
Yeah.
And I'm going to assess dehydration.
Put on shorts for me.
So next I'm just going to look at the nails. They are not clubbed or anything like that. I'm going to test capillary refill. Capillary refill
I'm
is less
done.
than 3 seconds, which is what we want. And dubing. Okay, so next I'm going to begin assessing the respiratory system. I'm assessing the breathing pattern, which looks normal. And do you have any cough? Any issues? Congestion? Are you a smoker? And now I'm going to be testing for chest symmetry and expansion. So just breathe in. I don't care.
She's
Same
not
thing.
fun right now.
Good. And I'll begin to palpate and let me know if you have any pain.
Yeah, she said.
And now I'll begin testing for tactile firmness and just say 99 whenever I touch you. 99, 99, 99, 99. And again.
99, 99, 99, 99.
So now I'm going to percuss, and everything should be resonant. And everything was resonant. And so now I'll also take my lungs. And just take a deep breath.
Oh, you need to change. Change. Okay, I'm not gonna hear that long. That was 20 minutes long. I didn't see it in my bag. Oh, she's doing it.
And I did not note any adventitious sounds. Okay. Okay, so next I'm going to begin the cardiac assessment. Have you had any issues with your heart? No, good. So I'm listening to aortic, pulmonic, heart supply, mitral, and tricuspid. And I did not hear any extra sounds, only S1 and S2. So next I'm going to begin by feeling all the pulses. I'm going to feel the temporal pulse, the carotid, the brachial, radial, and I would feel the femoral pulses as well. I'm going to feel the popliteal, posterior tibial, which is in the inner ankle, and then the dorsalis pedis, which is on top of the foot. And then I'm going to check the capillary refill in the toenails as well. And it was less than 3 seconds. Okay, so that concludes our assessment. So I'm just going to remove my gloves. ensure the patient's bed is down, the bed rails are up. I'm going to give the patient the call bell. Ask the patient if you need anything. Do you need anything? Okay, so I'm going to wash my hands and then document.